Thank you, Michael. Now, the state's 88-page indictment claims that the YSL gang is one of the...
Well, hello there. It's Tuesday. Happy Tuesday. And welcome to another edition of Soultiful. Guess what we're talking about today? The health care industry. We have a dynamic medical virtual, yeah, that's what I said, medical virtual assistant who's going to share with us all about what she does and changes and things to come in the healthcare industry. Don't you move. There might be something you need to know. Come on in. It's time for Soultiful.
Hi, and welcome to Soultiful.
Hey y'all, how's it going?
Happy Tuesday. I am Janet.
I'm Toya.
I am Shona.
Shanae, I thought you forgot your name for a minute. I was a little concerned. Wait a minute, we might need to go take you to the doctor. Get you a little bit of medicine. I'm sorry. We have a cheerleader in the background known as my
She wants to be part of the
grandbaby.
show, Janet. I'm not sure why you haven't booked her.
My grandbaby
I
is
don't know
not going
what
to be a
happened. My
guest.
sound went a little low.
It did. Oh, it's okay. It's okay. Well, hey y'all, what you working on, Toya?
Yeah, so today I was booked for a show, last minute show, and it was about Mazatlán. I'm saying that right, Janet? Mazatlán, Mexico. And it was really fun. It was great because I didn't know anything about the city. It's just a lot of caveats. Like it's known for shrimping, like this the biggest shrimping place in the world, something like that. And it is a tourist attraction, but it wasn't made. It didn't start out that way, like Cozumel and some of those different places. So that was really fun doing that show today. So that is what I've been working on. What about you, Janet? What would you been working on, sis?
So, I was working on reconnecting with some people that I met at a networking event yesterday. Normal client work, making sure that they have their to-do list for the day, and then getting event ready for the Wildin' Out this weekend in Atlanta. So, yeah, that's what I've been working on. Shanae, tell us what you working on over there.
I'm actually working on perfect media pitch. I joined a master class which started yesterday. So I was working on my homework, trying to decide what kind of pitch I'm going to do and what I'll be focusing my social media on when I'm done with this master class.
Oh, that's
All right
awesome.
then. Yeah, yeah. Yay for the master
Yeah,
class.
that's pretty cool. I always get excited hearing people, doing things to make themselves better, like personal development, developing their business. That's amazing. Awesome, sis. And guys out there, you Soultiful soldiers, we want to know what you're working on too. So feel free to put it in the chat. We want to know, what are you working on today?
Anybody working on getting me $1 million? I'm sorry,
I
that didn't.
mean, while they working on you, can they work on me? I'll
That,
do good things with that money. I promise.
you will. I ain't promising
Yeah.
I will. I'm gonna go somewhere. I'm just gonna go somewhere where nobody can find me. I don't need you. I don't need telephone. I don't need nothing. I'm gonna just be gone.
I'm gonna
Send
feed
me
my
the nigga.
children. That's what I'm gonna do. I'm gonna feed all of them.
You do got a squad over there. You need to feed every one of them. That is so very true. So as we told you, you know that me and Toya. Oh, I'm sorry, our other sister LW. She's not here with us today, but she'll be trying to join us momentarily. She is working on a major project and she is just
Hi.
consumed. So she may join us, she may not. But come on, LW, do what you do. So you know that me and Toya, we are virtual professionals. We don't use the word assistant. And then we now have this dynamic young lady, Shanae, who has joined us, who's in another area of field doing virtual assisting in the medical industry. So let me tell you a little bit about her. Shanae is the founder and CEO of Call Your Admin LLC, having worked in the public sector for over 20 years. Ugh, who can work in the public? Never mind. That's just me. She decided to make some major life changes, haven't we all? So after much soul searching and contemplation, she decided she was tired of working hard for someone else. Amen. Amen. Let me cheer her in the
Hallelujah.
back. Let me cheer
Hallelujah.
her in the
Yeah, yeah.
back. So she created her sister company, Call Your MVA, after seeing the need for small medical practices needing assistance with front and back end on their trying to do everything by themselves. She has assisted practices with increasing their revenue by appropriately billing insurance companies. I had questions about the insurance companies, but we're going to come to that. And private pay patients and streamlining processes to run their business more efficiently. Hey, let's give a Soultiful welcome to Shona Barnes.
Welcome, sis. So glad you're here.
Hi, thank you so much. I'm so excited to be here.
So Shona, let's get
Hi,
to
baby.
the child. She my cheerleader. Let's get to the meat of the issue.
Yes,
These
ma'am.
insurance companies. I know that medicine, somebody is getting a kickback, either the doctor or the a company. But how does the government play in the role of all of this? Because I remember when my little copay was $5, $10. Sometimes my copay is $50. What I got insurance for? Tell me. I want to know.
When dealing with insurance, seeing from both sides, right? As someone who has insurance and then someone who's actually billing for for medical businesses, it's it's hard to even say what's going on because I've had people like scream at me because they don't understand their insurance. So insurance is a mystery, right? Even with me working on knowing both sides, I'm still a little confused as to why is it this. For instance, I have a nutritionist that I work for. We bill $168.75. We may get $60 of that from the insurance company. And then we have to write the rest off. So insurance companies set up their own fees, what they feel that they should pay you. And you can, of course, bill what you're going to bill, but they're only going to pay up to a certain amount. And then you have like Blue Cross Blue Shield, they're with Care First, and they have multiple policies, right? Not all of them pay the same rate. So, and then when you get into deductibles and copays, of course, the higher your deductible is, the lower your copay is majority of the time. So I really stress to people, really look at your insurance and do your research to find out what they will pay and what they won't. And like really dig into your plan, because I've run into this where my insurance covers it. Yeah, they tell you they cover it, but they don't tell you need a prior authorization. And then you're left to pay the bill. And then the doctor's offices are sometimes at a loss because you're stuck to pay the bill. You don't want to pay it because you don't think you should pay it. And then then that's going to end up hurting your credit. Well, with the new ruling coming, they won't be able to do that for, I think it's like 6 months or so.
What's the
I
new
still have to do
ruling?
my research. There's a new ruling for the credit bureaus where they will not be able to report non-payment on past due medical bills. I believe it's for 6 months. But I'm going to post about this on my page after I finish doing my research and get the full information. I will share that with everyone because that's something important to know, because a lot of these hospitals and doctors' offices will send you to accreditors quick. With my clients, I will try my best. I still have patients I haven't paid since last year, and they're just now starting to pay. I don't want to send them to collections. I want the money, because then we got to pay a collections agency to collect, and then we're only getting a percentage. So I fight hard not to even have to have that happen. But, there are cases where, again, the insurance the person didn't really know what their insurance was. They got blindsided. They done had 3 to 5 visits, and now they're on the hook for all of this money. And it's unfortunate. So it leaves the provider in a situation, and the patient. Insurance company is fine because guess what? You're paying your monthly premiums every month.
Wow.
So definitely do your research on your insurance policy. When it's time for you to sign up for your insurance, do your homework. Do your homework. Start, if you think you want to switch insurances, start doing your homework in advance so you'll know exactly what you're getting. Ask the questions. If you can talk to your doctors and get the CPT code that they're seeing you for. Like, for instance, if you're going to a nutritionist, they're going to see you under 97803. Ask your insurance company, do you cover this? Is it fully covered? Will this go towards my deductible if you have one? There are so many questions that people don't ask. Then I get surprised because then I have people saying, I didn't get a bill. And I'm like, well, you're not getting the bill because your insurance covered it. So, it's very important to do your research on your insurance. Again, and don't get mad at the biller because we only can do what we can do. And like I said, I've had people very upset with me and, well, why did you let me go this long? Well, the insurance companies can take anywhere from 30 to 90 days to pay out a claim. So, and then that's just convoluted when you get into all the different insurance companies, because again, it's different. Aetna has like 50 million different payers in their network. So it says Aetna on their card, but I might need to bill Preferred One or Advantage Health, or, it's a lot. And if you don't do your research, you'll be left on the hook to pay a lot.
Okay, so I know you said do your research. However, because we have both entrepreneurs and corporate um, people watching, an audience. So with that being said, if you're working at a corporate entity and this is Aetna is the designated insurance for your company, you technically can't really go outside of that Aetna. How do you suggest that they make that insurance work for them or any insurance? And then I have to flip for you. What do entrepreneurs need to look for? If there was 3 top questions you could tell entrepreneurs to look for in searching for insurance, what would those 3 things be?
Okay, so as we'll start with corporate, right? The business owners, when you are setting up your insurance plans for your employees, you want to make sure that, how can I say this? You want to make sure that your company as well as your employees are getting the best deal. Because a lot of companies do actually pay a percentage towards the premiums. So every company, every business owner should be looking at exactly what, the bottom line numbers. Because if it's not going to be affordable for your employees, what is the sense in getting that insurance? I've seen people paying, almost $100, $200 out of their paycheck, which could put a lot of people further down into poverty, where, yeah, they're making good money on paper, but once you take out the insurance, their paychecks are barely enough for them to cover, life, their bills, not medical, mortgage, utilities and things like that, because the insurance companies take, so much. I would also, that's basically all I can really say about as far as corporate. As an individual looking for insurance, you want to find out if you have secondary insurance, who would be primary, who would be secondary. If your primary insurance, if you have a deductible for your primary insurance, will the secondary insurance pick up the payment? I see this a lot. The secondary, because it's not in their plan that they will pick up the deductible or the copay, then it's the responsibility of the patient. So you want to make sure that you know exactly what you have to pay if you have two insurances. A lot of people that are married, husband or wife has insurance with their job, and then you get a job and now you have insurance. Generally speaking, your primary insurance would be the one that's under you. And then if your spouse has insurance, that would be secondary. So you want to make sure that secondary insurance will pick up any deductible for you and or copay, so you don't have to pay out of your pocket. Because that's something that happens a lot too, because people don't know. Oh, well, I have secondary insurance, and they assume that it's automatically going to be picked up, and it's not. If you have Medicare is a big one. Please make sure that you know which Medicare you have and what they exactly cover. And of course, Medicare is more for the older, the more seasoned folks. However, there are some younger because of different disabilities that may have Medicare. So you have to make sure that you know which Medicare you have, type A or type B. In going in. Just look at what they cover, how much they cover. Of course, the higher deductible, the lower your copays are. But you want to make sure it's something that you can afford. And even I know with the marketplace, some of them are still pretty high. But I would take a look at, if you are sickly, then of course you want to make sure you have the best insurance out there. If you're pretty healthy, then I wouldn't go for a plan that has a high deductible, because you'll be paying for all of your services, because you're never going to reach that deductible if you're a healthy person. You don't go see the doctor, but to have your yearly physical, that kind of defeats the purpose. So look at what you and your family, as far as your health is concerned, do you all take a lot of visits to the hospital and to the doctor? So those are things I would definitely look out for and ask questions about. Basically starts with you knowing how your health is, and then moving forward and asking the other questions. You have diabetes. What will this insurance cover with you having diabetes?
So I love that you said it starts with you. It's so individualized, you know what I'm saying? I've gone to worked at some places and just, okay, this is the, recommended package. This is what you should do. And, it needs to be more customized to my specific situation. I have some health challenges. And I love that you said that if you don't necessarily have a lot of health issues, you may want to go for that plan that does not have the high deductible, what have you. You have some options. It's just a customized situation. And we need to educate. So I don't know, Janet, about you, but this is the most information I've ever received from VA about medical stuff. I'm just saying. So in order to be great like you are and be informed, do you have to take a medical billing courses? What do you have to do to be able to do this type of work?
So I actually, back years before I even thought about being a virtual assistant, I did take a medical office specialist certification. and they taught me billing and coding there. Of course, just the basics. And then I went on to work in back in 2006. Gosh, that's a long time ago. I went and worked in my first mental health office, and they were having trouble with billing, and I got in there and I was like, oh, I'm pretty good at this. So then I got to my next job working with one of the larger hospital with a radiology clinic here in DC. And then I went on to a hospital and worked there. And I was like, oh, okay. I wasn't necessarily doing billing at the hospital. However, I was still looking at the codes because I'm like, oh, I love the medical field. And so I was like, okay. So now I'm at the point where I've done work with 2 or 3 clients doing billing in my business. I'm like, I think this may be the niche I need to focus on a little bit more now, because I'm seeing that there are so many mental health and nutritionists especially that need this type of assistance because they're trying to do it all by themselves. And like the client I have now, I was trying to get her for a while, and she finally came on. We started with a small package, and then now I'm like her online business manager, and I'm doing all of her billing. And once she saw everything I was doing, she was like,
So awesome.
why couldn't you come around 6 years ago when I started my business? And I'm like, you know what? Everything has to do with timing.
That's right.
This is the time that I was supposed to enter your life and help you do what needs to be done.
Go ahead.
Because now you're ready to move on to the next part. And we're actually about to open another office in Georgia.
That's so cool.
So with that being said, that you're touching on the mental, and it seems like every day, and I know you're not a doctor, but just as a person, as an individual, every day we keep tapping on the door of mental. I mean, just the other day, the young man that went and shot up the grocery store had mental issues, had a psych evaluation because he tried to shoot somebody in the school, passed the psych evaluation, and now he did this. With that, anyway, with that all being said, do you find that the mental health industry is vastly growing beyond their capability to handle patients? Or is it more the medical, not the medical, the money to surplus that industry? Because that industry is growing so vastly. Are there enough doctors, et cetera, et cetera? What do you think from where your standpoint, where you see things?
I think the mental health field is growing because people are really starting to pay attention. That mental health is a true issue. And for people of color, like we've always been told, you don't tell anybody your business, right? But now as we're getting older, we're seeing that, no, I might need to talk to somebody. I need to decompress. I need to get this off my chest before I go do postal, you know? And I think that sometimes, you know, people are good at pretending. So even though they pass the psych eval, you don't know how many times they've passed the psych eval, how many times they've done it to learn what they need to do to pass that psych eval. People are good at faking. A lot of business owners fake it till they make it.
Yes, they do. Yes,
you know, so, you know, people are good at that. But I think now with mental health, with everybody really seeing that it's a good thing, and it's not just telling people your business, that it's opened the doors where more people are open to it. And so more people are running. And so these poor mental health professionals are overwhelmed, especially if they're just trying to do it by themselves. I know mental health professionals that are seeing 25 people a week by themselves. Can you imagine an hour long with 25 hours a week that you're listening to other people's junk?
No,
And the
ma'am.
therapist needs a therapist. And if they don't have one, then you need to get a new therapist.
That's absolutely correct. Absolutely. I'm with you on that. Therapists need therapists. That's right. Ooh, so Shanae, let me just say that I have a kind of a heart for the mental health community. Like my father's like a pastor, my sister's a psychologist, and this community is important to me. You know, we kind of segue to mental health. But when I've tried to work with some mental health professionals and actually medical professionals in general, I found that they're looking for like an employee relationship. In that particular field, it's hard for me. I don't haven't been able to kind of provide support because they're looking for an employee. Every person I've talked to, every discovery call I've had, they're looking for someone in the office, an employee. How was that ever an issue for you? With working.
So I break it down like this.
Mm-hmm.
Everything that you have that person doing in that office, I can do. You know, having me in there, one, if you have me as an employee, you're paying for my medical benefits, you're paying for my vacation, sick leave, you're paying for all of this overhead. And then you might get 2 or 3 hours of work out of me.
That's good.
Would you prefer to do that, or would you prefer to pay someone, you know, you're paying them a certain amount each month and they're getting everything done? I mean, I answer, well, I don't personally answer phones anymore, but I hired someone on to answer the phones for my clients. They answer the phones professionally, schedule the appointments. I mean, in this day and age now, with everything being virtual, I mean, I don't see why they wouldn't want to now, especially go ahead and dive deep into getting, you know, virtual help. To have someone in the office who's just sitting there bored because you have a patient come in once an hour it's not the best use of your money and or your time.
Girl, you said that very clearly and simply. Yes.
Yeah, the same thing that you need done. You know, everything is electronic now. Not a lot of people are not using paper. So you have the electronic medical record systems that we use to do the billing, to schedule, to put the notes in. You don't really need someone in the office. I know it's a comfort thing for a lot of people. And so for those people that aren't ready, then they're not ready. And then I've heard back from some people that are like, okay, I think I may be ready. But then it also has to be a good fit. Because if I feel you're going to be a micromanager, that's not a good fit for me. I don't work well with micromanagers. So as a business owner, I have to know my limitations.
That's right.
And I can't say yes to everybody.
That's right. That's good. That is good. You know thyself as a business owner. Know who you can and what personality types you can and can't work with and all that. That's good and simple. You broke that down real simply, sis. Like it's more cost effective if I work from, and then you're not bored, all those things. So that was helpful for me. So that's good because I probably had a block. Like I can't work with them because they want an employee, but you just have to explain some things. And if it's not a good fit, then okay, moving on. Yeah. So awesome.
And sometimes because it's the new age, especially when you're dealing with older people, it's the new age thing to them and they don't want to let go. I mean, they don't want to let go of their papers. They don't want to let go of the reins, even though they know they need to. So sometimes when you break it down and make it very simple, sometimes they slowly get on board. Like I had one, she was slowly getting on board, but then she kept taking everything away. So I had to let her go. We had to part ways because I can't set everything up for you and then you destroy it. Ooh. That's not the best use of my time. Yeah, you're paying me, but all money isn't good money.
Amen to that. That is awesome. You're muted, Janet, if you're speaking. Amen to that.
Say that again for the people in the back. All money is not good money. That is so
all money
true.
Isn't good money.
Mm-mm.
So, Shanae, So you mentioned that you hired somebody to take those phone calls that you no longer are going to take. You did it, but you're not doing it anymore, right?
Here she
So,
go. Here she go
but
now. Go ahead.
so all I'm saying is that alludes to that you got an agency. It's not just you doing this work. And for a lot of people in this industry, that's a dream to have an agency. So I want to know, like, how did you do that? How did you start an agency? That's what I would like to know. How did you do that?
Okay. So, knowing who I am and
Hmm.
how I would want to be like, oh, I can do it all, I can do it all. But then when I start doing, I'm like, I don't want to do this. It's like, I like it, but I want to offer this service, but it's not something that I enjoy doing. I don't enjoy answering phones for 7, 8 hours a day, you know. So I outsource.
It's not that bad. It's
Anything that
really not
becomes
that bad.
repetitive, and you know that you're not going to get the best work out of me if I'm doing something that I don't love to do. So
Right.
I outsource. Like I even
Awesome.
have for this client, um, I have a bookkeeper. Not because I don't like to do numbers, but she's better at it.
Yeah.
And
Yeah.
we talk all the time about the numbers. So
Awesome.
I'm still talking to my team, and we have meetings once a month with the clients to let them know what's going on, what we're working on. We have a sauna going. We have all these things in place because it is hard. It's hard to get good people.
Yeah.
I've had people come on and I was like, oh my gosh, why? I should have just did it myself. But you never know, you try to give people an opportunity.
That's right.
So, can't beat myself up. I do in the first 5, 10 minutes and then I get over it and I'm like, okay, let me go ahead and bite the bullet. Let me get this done and find somebody else to come in to take over.
Awesome. Awesome. What I didn't hear much about was your background. I mean, you have a family, and sometimes it's nice to hear about it because people don't understand. Like, how do I like for me? How do I go from taking care of these 6 kids to running a thriving media business? Blah blah blah. So, talk to us
Yes.
about your background, if you will.
So, I have 3 children.
Mm.
They're older now. My oldest is 26, and then I have a 20-year-old and a 16-year-old. I started my business in 2012 after losing 2 jobs in 2 years. I was having bouts with lupus. I'm now in remission, thank God. For the
Woo!
last 3
Amen.
years, I've been in remission. But between my lupus flare ups and my children behavioral problems with ADHD, my 2 younger ones, I had to keep calling out of work, and it was becoming too much. And I ended up on a Facebook Live meeting, actually, networking event. And they were talking about how you could monetize your skills. And I'm like, I have a lot of skills. I've been an admin, I've worked in the medical field, but I don't know how to put this together. Well, I ended up talking with Tyshina Davis, who is now the owner of Publish Your Gift. She actually moved from virtual assisting to a book publisher. And she introduced me to the VA world. And I mean, she helped me come up with the name, Call Your Admin,
Oh,
and
that's awesome.
everything, and had me do my SWOT, and was like, well, what do you do? What have you done in your life that you can monetize? And of course, I've been an admin since I was probably like 16, 17 years old. I was working in different offices as a teenager, and then in the federal government, and then for private sector jobs. So that's where I started. I had as a means to an end. I needed to still bring in money to take care of my family. And so I bit the bullet and was like, okay, I'm going to start a business. It hasn't always been easy. I mean, I went to start doing, like, I was doing Uber and Lyft in between doing patient, I said patient, in between doing client work, I would go out and drive, pick up people, make some money to make ends meet.
I think I remember that. That is, girl, dog, that is amazing. You would just kind of look back from where we came from, right? You know what I'm
Yeah.
saying? That is amazing. And stuff like that, that's inspires people. That is so inspiring, Wow. She was doing her work and still driving people because it's what she needed to do at the time, y'all. You know what I'm saying? This ain't no sprint. This is not a sprint.
No.
It is that's it. It's a journey. It is a journey, and sometimes it's fast and fast money. Sometimes it's slow, and all that. So that is so cool, Janet. I know you're dying to say something, to ask something. What you got?
No, I was just saying sometimes you gotta put the money on reserve.
Yeah,
Sometimes you gotta
man.
hold the money. Yeah. Um no, but just I've asked all the questions. 'Cause I was really interested in the insurance that
Mm.
the I know somewhere, somehow everybody's getting a kickback except for us, the sick people. Because things are just steadily changing.
Yeah.
And I even think that with COVID, it brought on a lot more. I don't know necessarily the word scare, but it brought on a lot more insight because when people got sick with COVID and they didn't have no insurance, what were they to do? A lot of people stayed at home and suffered through the couple of weeks of trying to make themselves better. And
Yeah.
some people got better, some people didn't get better. Some people didn't go to the hospital because they know they didn't have insurance. But you would think that would open up the government to make more programs or something so people can have affordable insurance. But no. And then the other part of it is the way this mental health industry is rapidly growing, and there's nobody taking care of them. It's I
I
know.
will
Go ahead. Hmm.
I will say, as far as the government, it becomes it becomes difficult when it comes to the states. Like, for instance, here in DC, where I live, you could be making $16, $17 an hour and still get Medicaid
Oh
based
Hmm.
wow.
on your income. You can still
Not
get
here in
Medicaid,
Georgia.
whether as a single person and or as a person with children. So it also depends on your state. So I always say visit your marketplace, because your marketplace may let you know that you actually qualify for Medicaid.
Yeah, not here in Georgia, but then Georgia is a Republican state, so
Hmm.
um, but you are right because each state has different. That's why, and I know this is the bad time for this. This is why I'd be like, don't worry about the presidency. Get that local government.
Local
It's that
government is where
local
it starts.
government is who's fighting for you because he up there, he in DC, he chilling. They all right up there. It's the people that's down here with me in Georgia. I mean, right now, and not to segue off of what we're talking about, but do you know there's two governors? Well, there's the man in office, and there's another governor who was here before. Them two is fighting back and forth while Stacey's trying to. What? Nobody's come. Only Stacey's the one presenting the platform of what she play. But y'all two so busy trying to fight for the seat, you tattletaling on each other. And it just
Yeah,
so those are the
it starts
things.
with local government. And I
Yeah.
know DC is one because we don't have statehood. So I think that makes some of the difference for us here. Like everything, like if you get arrested in DC, it's a felony. It's an automatic federal charge.
Did not know that.
So, yes,
Wow.
because we're federal land.
Wow.
So,
Wow.
yes. So, there's just like people right now, a lot of people want DC to have statehood, but I don't think they fully understand what that could really mean. That could mean a lot of changes to the social programs that DC has, like the summer youth program. They have programs that help DC residents with getting jobs, getting free training for jobs. That it could mean a big difference.
So if you this and I didn't know that, and this may seem simple question, but if you, I don't know, run the red light and get arrested for it, that is a federal.
So let's talk about they give tickets. They have cameras here, and we just get tickets. Cops don't normally pull you over for running the red light or a stop sign because they
Okay.
have camera tickets here. But if you get arrested for a DUI, yes, you can go. You'll go to federal, and you're convicted. You can go to federal jail. Yes, someone who was gambling or racketeering, federal. All felony offenses.
All right. Okay.
Well,
Mm.
ladies, normally we when we have to do VA interviews, it's about 30 minutes or so. But I feel like you're our sister and I want to continue on. So is it okay we do a lightning round? Just some fast little
Sure,
questions.
game.
Okay. Okay, cool. Okay. So my first question is what is your favorite virtual assistant tool? What you use out in the streets to make your business run?
My favorite right now would have to be Dubsado.
Okay. Okay. Can
Only because I can keep time. I do have one client that I actually track time with. Most of them I don't. But this one I track time, and I don't have to go outside of the system. I can track it, and it's right there in his invoice, and it can go. But Dubsado right now is my favorite.
Me personally, I'm glad to hear you say that because I feel like Dubsado does not get the love that it deserves.
Mhm.
Like right now, Honeybook is slanging their $1 for 6 months accounts and stuff like that. You know what I'm saying? So everybody's going over there, but Dubsado, oh my gosh, you can customize it. You can do so much stuff within that. For me, even my accounting, like I go and I put, all that stuff. Really simply, I can do everything almost in Dubsado. So.
Yes.
I'm with you, sis. I'm with you.
Yes,
Dubsado for the
is the
win.
favorite right now.
So she's that real, y'all. She used real tools. We use that in our business every day. So love it. Awesome, awesome. All right, Jen, I'm gonna ask another one, and I'll let you go into some lightning round questions. I know you got some. All right. I want to know something interesting that you don't usually share in your interviews. Something interesting about yourself that we're gonna be like, oh.
I actually, from the age of 3 to 13, lived in North Pole, Alaska.
Okay, I got to pause. Black people live in Alaska?
Oh God.
Yes, I knew that question always comes. My dad was in the military, and we were stationed at Fort Wainwright. So we were there for the Santa Claus house. And we used to, for our community service, we would write Santa's elves to the kids back here in the lower 48, as we call it. We would write back to the kids for community service.
That's cool. I told you, Jen, it was a unique situation. Military. Yeah. Well, that's interesting. That I would have never known. Awesome. What you got, Janet?
I don't know. Nothing has crossed my mind. Okay.
I got what I want to know. How long have you rocked the locks? Because those are gorgeous.
The locks have been in place since 2010.
Oh.
2010. Wow. I did the big chop in 2009. And I think, what did I do? What made me this? I had an afro. And a Caucasian lady said, "Oh, look at you being all Afrocentric." And I'm like,
okay, thank you.
Okay, let me start to do something with my hair. And so I was getting it braided, and my husband at the time, he was like, "Would you just lock it and just be done with it?" So he started my locks for me in 2010, and rocking them ever since.
Because you
Best
have
decision I've
dreaded
made.
locks. Love them. Awesome.
Okay. Okay. I still haven't come up with nothing.
That's all right. I got another one.
Yeah.
I would love to know. I know that you're well read. I know that you're inquisitive. You're always learning. That's why I always like the you're always you just are. I would love to know like who is your favorite mentor? Like who do you look up to?
Oh my goodness. I read so much that I can't
Yeah,
even pinpoint one because I
Okay.
like to take in from different perspectives
I
too.
understand that.
So it's hard to just pinpoint this person.
Okay. Okay.
Like I read a lot of Deepak Chopra stuff,
Yeah,
and
Okay.
then like Dr. Avis, who's doing the master class that I'm in
nice.
for Pitch Media. Like she's just so wonderful and brilliant. And then, like I said, Tyshina Davis, who started me on my journey. Like I'm always watching her to see what she's doing.
Okay.
I look at you all stuff. I may not always say anything, but I'm looking and watching, and just happy that you all are still still going. There are so many VAs that when I started that are no longer in the business because it wasn't clicking for them.
Yeah.
So to see my sister still rocking and
Yes.
moving,
Yes, sister.
and that we're
Yes.
still inspiring others to keep moving.
Yes.
I think if I had to pick, I would have to say it's the sisterhood,
The
the
sisterhood.
sisterhood,
Awesome.
the
Awesome.
sisterhood as a whole.
Amen to
Okay.
that. Love it. Love it. Let me just do a shout out to Mama Dorch real quick. She says she's still in the hospital. So we're praying for you. Thank you for being here in despite. Yes, we love you and we're definitely praying for you. Glad you're going home tomorrow. Thank God for you.
Yeah. Yeah. Get
Thank you
well,
for the
Mama
prayer.
Doris.
Yeah.
All
Yeah.
right then.
Yeah, and I'm with you on the sisterhood, whatever that looks like. We have group, they have group, we all have groups and all that, but just the sisterhood to see. Sometimes you just peek into a group and see, oh, she's still going strong. That is so helpful. That I draw so much strength from that. So I'm with you on that. Yeah. So awesome. Well, we have about 10 minutes left. So like we said, we want to make sure that you get the last words. There are VAs watching. They're watching the show right now. I definitely want you to speak to them because I know that you have an offering for them. There are people that are in the medical field specifically, and they're like, what? The VA? I don't even know how to start. I want you to talk to them too, sis, because where I didn't have the magic touch, I didn't know how to connect them. You do. So are you laughing, Janet?
Yes, that is. Yes, because you
Because it
don't
said the
like
magic touch.
phones. Because you don't do phones and the magic touch. Yes.
But you do phones and we work together, so that's still
Yeah, I
all
do
right,
the phones.
Shonda.
You do everything else because I like talking to people.
All right, Shonda, go ahead and talk to the viewers, sis.
All right. So if you are in the medical field and you are looking for a VA, I will give you some things to actually ask your VA to make sure that they have your best interest at heart and that they are skilled in what you need them to do. So one of the things is to find out if they have actually worked in the medical field. Those that have worked in the medical field have a little bit more knowledge and are a little more, I have found, are a little more empathetic to dealing with patients. As I said, when I was on the phone, I've had to deal with people that were having mental breakdowns, and to be able to talk them down and get them calm so that they can get what they needed. So really look for someone who has that personality that can help manage different crises, especially dealing with patients, especially in the mental health field. You have someone with a nice, calming voice that can just send warmth through, anybody's soul. That is the biggest thing that people your VA, especially if you have them answering the phones, that's the first person that they connect with. And so you want that connection to be good. If you're looking for a biller, I won't say that they necessarily have to be certified in billing. I'm not. I'm actually going to do the test though so that I can become certified. But they need to know how to do the basics in an EHR system. Most of them, they can find tutorials to learn. For VAs, if you want to crack into this field, sign up for any of the EHR systems that are out there. You can do like a 30-day trial. There's Simple Practice, there's Calyx, there's Therapy Notes, there's Theranos. All of them offer 30-day trials, so you can get in there and you can play around and see how the systems work, so that you'll be a little ahead of the game. A lot of therapists nowadays are using Simple Practice, Therapy Notes, or Theranos. There are medical billers that actually have their own systems and may want you as the provider to join their system. That's totally up to you. I would caution that if you do use a medical biller system, to know that if you decide to sever the relationship, it may be a little difficult to get that information from that biller. So I always suggest that you be in control of your own billing system. What else? I am available if anyone has any additional questions that they want to ask about for the VAs, for how I got into the field of becoming a medical VA. For those that have medical businesses, I do have bandwidth for additional clients. I do always start off working one-on-one with all of my clients. And if the need arises, then I may outsource. The majority of the time, I am the person that you will be working with directly. I'm also starting a business mentoring consulting business called Purple Butterfly International. So anyone that is in business, wanting to start their business, I assist with you putting all your ducks in a row, making sure that your processes are set up correctly, and then identifying where exactly you want your business to go and what's the plan that you want to get there. I'm not saying that right, but trying to strategize on the best way to get you to where you want to be. A lot of coaches out there now are promising all these dollar amounts that you can make. We can't promise that. We can give you the tools and help you to get to that next level. So I think that's about it.
She is so honest and so sincere. It is such a blessing to be connected with folks like that. Yo, I'm just gonna say she kind of said the word coach, but she is a whole coach out here. Purple Diamond, Butterfly. She's a whole coach out here. If they are interested in getting coaching from you, who knows exactly what you're doing to be a super fantastic medical VA, should they go to your website, or how should they contact you, Shanae?
For coaching, you'll email me at hellou@purplebutterflyint.
Okay, put it in the private chat, or definitely put it in the comments after the show, so people, if they're interested, they'll go there. Because I can just say personally, I have been connected with the sister for at least the last 3 years, and she's gone through the journey. It's like, this is the real deal. So It's not somebody just saying, I want to be a coach now, like people do, right? How many life coaches y'all know that took the certification to be a life coach? And now they're life coaches. But she's actually lived the life. And she's continuing to live the life of a VA agency owner. So definitely connect with my dear sister if you're interested. I'll put her email up here now. Yes. That's so pretty. That's beautiful. My favorite color is purple. Awesomeness. So yeah, if you are interested at all in learning how to be successful in this industry, and she's not giving you a dollar amount because you got to do the work, but she's in the journey. She's done this for years now. So hello you at purplebutterflyint.com. Yes. Janet, you smiling. Are you happy with me today? Am I good? Did I do okay? No, she's not smiling.
I didn't know I was supposed to be happy with.
Well, Shona, if you ever watch the show, sometimes she gets a whole fist of like she's finna do some of these fists, and it's directed at me. So I was just wondering, are we good today?
I think y'all are good today.
I think so. I think so. Guys,
I'm just going with the flow, Shanae. I'm just going with the flow.
We appreciate you, our dear viewers, coming through today. Come on back this time next Tuesday at 6:00 p.m. EST. Please like our YouTube channel. It is Soultiful. Please go to YouTube and like Soultiful. We would really appreciate it. And shout out to Latoya Williams. We know you were handling your business. We missed you. We love you, and we'll see you next week. And Shanae, I can't even, my heart, thank you so much for engaging, being entertaining. Thank you for sharing your knowledge, because there's a lot of stuff I just didn't know at all. So, and while she's out eating her food, I guess we'll end the show. Yes.
Who's eating food?
Yo, babe, you ain't eating baby in the background? Eat your food.
Oh, I didn't even pay them no attention. I'm so enthralled into the show.
Oh, and we updated our template, so I want to show that. I think it's cute. What you think? Isn't that cute, Shanae? I like it.
I like it.
Okay. Thank you.
I love purple, so
yes.
I'm a little biased.
That's my company colors, purple and gold and gray.
Love it.
All right. Well, remember to share, like, and subscribe. And we'll see you next week, Tuesday at 6 p.m. with another lovely guest on another edition of Soultiful. Bye-bye for now.
Bye, y'all. Thank you, Shanae.
Hi, and welcome to Soultiful.